على الفلاح. الله أكبر الله أكبر، لا إله إلا الله. اللهم أكبر.
الله أكبر. الحمد لله رب العالمين، الرحمن الرحيم، مالك يوم الدين. إياك نعبد وإياك نستعين، اهدنا الصراط المستقيم، صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. قل أعوذ برب الفلق من شر ما خلق، ومن شر غاسق إذا وقب، ومن شر النفاثات في العقد، ومن شر حاسد إذا حسد. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الحمد لله رب العالمين، الرحمن الرحيم، مالك يوم الدين. إياك نعبد وإياك نستعين، اهدنا الصراط المستقيم، صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. قل أعوذ برب الناس، ملك الناس، إله الناس، من شر الوسواس الخناس، الذي يوسوس في صدور الناس من الجنة والناس. الله أكبر. سمع الله لمن حمده الله أكبر الله أكبر الله أكبر الله أكبر الله أكبر الله أكبر سمع الله لمن حمده الله أكبر الله أكبر الله أكبر الله أكبر السلام عليكم ورحمة الله السلام عليكم ورحمة الله استغفر الله استغفر الله اللهم أنت السلام ومنك السلام وتبارك يا ذا الجلال والإكرام اللهم اغفر لنا وارحمنا وأنت خير الراحمين لا إله إلا الله محمد رسول الله. Assalamu alaikum wa rahmatullahi wa barakatuh. Just a quick announcement, inshallah. We're having a session, get to know the medical system. We have our guest for tonight, Mr. Asutosh, and also our brother Umair, inshallah, will be assisting to know that how the healthcare system work, how the OHIP benefits is, how to get the medical benefit, and there's a long way to go. So who may have a time, please participate, inshallah, and after that there is a refreshment has been arranged by them to this benefit, inshallah. Before this line, so they can see it. Just to move it, you can move around because this has a display. You see? No, it's
Just not high.
Yes. We'll also like step that out.
Okay.
Assalamu alaikum. My name is Omer and this is Ashutosh. We are part of the community and we wanted to give back by conducting this community project where we would come and explain some things about the healthcare system of Ottawa and some things that you would know to help with your families and the friends that need help.
Exactly. My name is Ashutosh. I live in Orleans. I grew up here. I want to support the community here. We're doing this because we want to be with the community. We want to support the community. We want to build it up. That's why we're here with you, and we're very thankful that we get to present in front of you today.
So to begin, just a little background of where we come from and our education. So I completed my Bachelor's of Biology Research at McMaster, and then I completed my Master's of Public Health at Queen's University.
I also completed my Master's of Public Health at Queen's University with Ahmed, and completed my undergraduate degrees in Psychology and Health Science at Ottawa, University of Ottawa, and Carleton University. And so today we're here to learn from the community itself. We want to hear what you guys what information that you guys want from us. We're public health professionals. We want to help promote public health or health in general to the community. And we want to help share really helpful information that is good for everyone to know, regardless if you're a newcomer, if you've been here for a long time, or anyone that's in the community. And we want to make sure that it's really easy to understand. So all the information that we're going to be talking about will be in these little information sheets, and you can pick one up at the end if you want more information about anything that we talked about today. And this is something that we want to build together with the community so we can all get good care, good information so that you guys can support yourself, your families, your brothers, your sisters, whoever in the community.
Exactly. The healthcare infrastructure or the healthcare in Canada is built to serve you, built to help you. And the way that we can help you is knowing what do you need from us? What do you need to learn? What do we need to learn from you? So these projects and these workshops are here to ask you what's on your mind about healthcare. What do you wonder about? Because I'm sure that the public health of Ontario can't make these decisions in the right way without taking your opinion into consideration. So that's how we build this project, so that we can reach out to you. And I encourage at any moment, if you feel like there is a question on your mind or an opinion that you have, please voice it out so that we can take it in and we can discuss together.
So our project and goals is one, to make everything really easy to understand. A lot of the time, there's so much confusing stuff out there. Where do I go? Which doctor to see? If I don't have a family doctor, where do I go? We have all these questions, but yet the public health or even health, Ontario Health, they're not really giving people that many answers. So we want to make sure that all this information is very simple to understand, and we want to make sure that everybody can navigate this, a lot of these systems in a really easy and understandable way. And we wanted to work with different community members, including faith groups. So at this mosque here, but also at the other mosques, at the other institutions. And we want to make sure that all this information is given to the community. Everyone in the community deserves good health care, and we want to make sure that everybody understands this information in a really easy way.
So before we begin with our content itself, we have to answer the question that we're trying to answer: what is health literacy? So health literacy is the capacity or to understand what is the health information you're getting. the system that's put in place or the structures that are said, what does that mean to us? Or what are the options that we have? So in terms of how we get across this bridge, we want to try to disseminate or try to teach these health terms to the public so they know what their options are and how to access the care that they deserve.
Exactly.
So some of the common questions that we've heard across the board are, what is health insurance? How does OHIP work? What are the options do I have? And other questions come to whether or not if a doctor is not available, what do I do? Who do I call? Where do I go? So many of these options have answers. It's just about getting that information to you. And that's what we're here to answer. With some of these questions we're going to cover in this presentation.
So one of the first questions that we've gotten throughout the community and throughout our conversations with a bunch of people is, where do I find a family doctor? How do I navigate the system, and how do I get someone to help take care of me? And that's a really common question. And unfortunately, the Ontario system has not been very nice to any of us with trying to find a family doctor, because there aren't enough right now. But we do have some information about what you can do. One of the things that you can do is apply for a family doctor online. That's probably the simplest thing you could do. It's one little questionnaire. You put your name in, and then they'll find a family doctor for you. That's one thing. The other thing you can do is also call clinics and ask them, hey, are you accepting patients right now? That's one of the easiest things you can do as well. But that in itself, you still have to call a lot of clinics. And the other thing is, if you don't have a family doctor, you can use walk-in clinics all across Ottawa as well. There's one down the street right over there, or is it over there? I forget which direction it is, but there is one here in Orleans, but you can also access them all across Ottawa. And one of the flyers, one of the information sheets that we have gives you all the different types of information about how to do your family search for a family doctor. Whether you go online, whether you go on that specific link, but you can also get non-emergency help as well. So, meaning that if you need any other additional support, that's not an emergency. Like, for example, if you break your foot, that's not that would be an emergency. But if you have a cold or if you have some sort of illness, they can also answer questions about where you need to go, how you're supposed to get there, and all that following information. But what is important is that when you are looking for a family doctor, you can ask for a male or female doctor as well. So you can pick what sort of doctor that you want. And let's say you get a family doctor, you don't like that family doctor, or things aren't good, you can also switch to a different family doctor as well if needed. And they will send you a recommendation letter to go to a different doctor.
Yes, in the flyer you'll find different ways to find other doctors. And it's important that you can also find a doctor that speaks a different language so that they can give better care towards you. It's not enough to find just a doctor to give you care. What we're trying to promote is that you can find the right doctor for you and that you have a right to ask for another doctor that can serve you better. Another option is that if you already have a doctor, you can ask them, I'm looking for a doctor that fits this criteria, speaks this language, or provides a different kind of service, help me find another one. And they will have to refer you to someone else. There are these options that you can take to find the right doctor for you, instead of looking for a doctor that may not fulfill what you are looking for. The other thing is Ontario insurance. Now, whether you are a PR, citizen, or if you have a working permit, you do qualify for health insurance. And it's important to know that health insurance covers doctor's visits and hospital emergencies, but it does not cover certain care such as dental, vision, and some medications. There is a resource that we're going to give to this masjid to understand what does OHIP cover and what does it not. And also, if you would need to apply to OHIP, it doesn't automatically come to you. Some programs would need you to apply to them for you to get the insurance. So that's a very good, important point if you are thinking about the cost of healthcare.
And just dental as well. Dental is one which dental and vision and some medications are covered by OHIP, meaning that they fall outside of that, and you do need to get support elsewhere for that. And one of the things that there's currently a program right now with the federal government, and if you fall under a certain category, you can get support for dental and medications. So that is something that we can guide you to, and so that you can apply for that as well if needed. So you do have options, and not everything requires you to go to the hospital. So for example, these are just some example situations. If you have a minor illness, you don't need to go to the emergency. You can go to a pharmacist. Pharmacists go to school for 4 years. They're licensed. They have a lot of education, and you can ask them for help. And you can ask them questions like, what medication should I take for this? Where should I go? This is my symptoms, what should I do? And if you do need to go to the emergency, if you do need to go somewhere, they will tell you where to go. So that's a really good resource to use. We've already mentioned about the walk-in clinics across Ottawa, but that is an option. And if you have any serious issues, you should go to the emergency room at the hospital. And for other information, or if you need any information specifically about that, you can always call 811, and you'll be connected to a nurse who will be able to help you answer any questions, help you get a family doctor, or any other additional questions about symptoms, or if you need to go to the emergency, they will help you out as well.
Yeah, if you don't know where to go, you can always call 811. It's a 24/7 service that connects you to a nurse, and that can help you either connect you to more services that are needed or advise you on what you can do in your situation. There was a brief mention on how minor illnesses, you could go to a pharmacist for some of these cases. Pharmacies are actually licensed to diagnose 13 illnesses, and they range from rashes to cold flus, and there's a list online that you can look at to see if you follow one of the symptoms. You can go to a pharmacist and ask them, and they are able to diagnose you right on the spot. There's no need to go to a family physician for that. They can provide the medication there. The other thing is that if you are prescribed medication from a doctor and you have to go to a pharmacist to receive it, you can have a conversation with the pharmacist and ask them, how many should I eat, or should I eat this before food or after food? These types of questions a pharmacist has to answer. They can also adjust your dosage if they need to. They can also give you some information on the side effects. What will this do after? What you should be thinking about when eating this medication. So pharmacies are a big resource that you can use for any emergency care. But if the emergency rises up to a case where you need to go to the hospital, they will advise you to do so.
Exactly, and the pharmacies are one of the resources that are everywhere here in Ottawa. A lot of people think that it's only for medication, and we want to make sure that that specifically is a resource that you can use for the future. So our main message is that when you have a lot of these questions about your health care, that is your right to ask those questions in any language that you feel. If you're not comfortable with English, that's okay. The healthcare industry and the healthcare providers have to answer in a language where you feel comfortable, so that you understand exactly what all of your concerns, and that way you get the clearest information about your health. And you can always ask for an explanation. If you don't understand anything, if you don't understand what's going on, they have to answer that question. Even if you ask a million times, they have to answer that question. And the other thing that you can always do is bring someone. It might just be my mic, sorry, or something like that. But you can always bring anyone with you. So let's say you have a friend that is really, if you want someone for moral support, please bring someone with you to help ask those questions and look out for you, or come with you to any. You have that right to do that. And the whole point of this presentation is to illustrate or let you know that everybody deserves clear information, everybody deserves respect, and everybody deserves access to good health care and to take care of yourself. And we want to make sure that you're confident after today and knowing where to look. And after you read some of the information sheets that we give you, you can some of your questions will hopefully be answered a little bit more.
Yes, so this is the first step of how we can answer your questions. If you have any concerns, you bring them out, and that we can go and make that change happen, or at least advocate for the rights that you should have. We've also brought these information sheets for the whole masjid, and we'll leave some here. You may take them to gain some more information about different aspects of healthcare.
And one last thing is, I don't think I mentioned this, but one of the information sheets is also about children as well. It's not, we don't always take care of, we have to take care of other people as well, not just ourselves. So we do have an information sheet about children and when to ask for support. So on the one side, there's a lot of information about resources to use. If you have any information, there's phone numbers, website links, and on the right, there's information about when to go in and what symptoms to look out for your child. So if your child has some symptoms, what to do and where to go. So we want a little bit of your input. We've talked to a lot of the community members, and we've kind of a lot of different type of questions. But is there any type of questions that you're looking to get answered, or is there any type of questions that you want to know more about, so that we could bring this further? We could come back and bring that information to you. It doesn't have to be right now, but please feel free to come to us and have a chat with us, so we can get to know each other a little bit better, and also answer any questions that you like.
Yeah, perfect. So I'll just speak a little bit about the flyers that we brought today. So the first one being about how, the weather's getting warmer. There might be pollen in the air, and you might have allergies or anything that causes a cough. This is a flyer that reviews respiratory illnesses and some of the symptoms that you might have. You can keep this, look at it whenever things feel a little like your sinuses or any sore throats, and this will give you proper guidelines on how you can reduce those symptoms or also seek care. The other flyers also talk about mental health and mental health supports. So any avenues of, if you know anyone that has addictions or substance abuse problems, there are also resources to help them as well. Just to wrap up at the end, if you feel like all of this information is coming at you too much at once and you need some time to digest or places to go, there are these areas called neighborhood health wellness hubs, and they provide vaccinations, dental health, social services, all for free. So we're leaving this flyer sheet as well, where you can contact them and see if they can help you in any situation that you have.
Perfect. Thank you, Mayor. Just letting you know, we also brought the refreshments. Feel free. We have some coffee, some tea, some timbits, and I think that's it.
Yeah, I just wanted to ask one question to everyone beforehand. Has anyone heard of the recent government change about medication payments for refugees or newcomers to Canada? Great. So this change has happened really recently. So in January, they announced that refugees and newcomers to Canada will now have to pay $4 for any fill-up of medication or any new medication. They will also have to pay 30% of any secondary health services. The basic health services are still free, but the secondary health services have now become something that refugees and immigrants have to pay. So this covers many groups of vulnerable populations, and it will be effective May 1st. So this is a recent change that now makes something that was free something that you have to pay for. So it's very important that for the newcomers that come to Canada, and as a service establishment, the mosque, this is one of the places that newcomers might come for help or learn about things about the system. This might be the first place they come to. So it's not, this information might not help you, but it might help someone that you might encounter in the future. So these resources here also give you that information to help others. So I think we've wrapped up our presentation. If you have any questions, please don't hesitate and come to us. If not, you can enjoy the free refreshments that we've brought, coffee, tea, and Timbits. So secondary medical services include either prosthetics, therapy, occupational or psychotherapy. There is also, there's a list that specifies all secondary, and so the ones that I remember are like the prosthetics one, the therapy options, dispensing. Yeah, dispensing medication. So there's a description on how you can learn more. I can also let you know the resource on how to learn more about that. Thank you so much. Yeah.
So I work at two hospitals. I work at the Children's Hospital here, and I also work at the Ottawa Hospital as well. And one of the biggest things that I've seen personally, I've also been in the emergency for a really long time, and I told as well. One of the really big things that we see is a lot of people, one of the reasons we also wanted to bring up all this information is because for a lot of people are also going to the emergency for really simple issues. It's issues that you could talk to your pharmacist about. Like Omer was saying about rashes. So if you get a rash, you don't necessarily need to go to the emergency. You can go to your pharmacist and let them know that, hey, I got this rash. They might give you an antibiotic. They might help you with medication, and then you're good to go home. But a lot of us think that we should go to the emergency right away. And that also holds up the line. It's not just necessarily to newcomers. Everyone can do it. Where in Ontario specifically, a lot of people don't have family. I don't have a family doctor. And that's something that that's something that a lot of people tend to do is use these emergency services when they're not necessarily an emergency. Sometimes they are. And that's okay, and you have the right to go to the emergency if you have any additional information. But as we kind of mentioned, there are some other resources that you can use instead of just going to the emergency first thing. Pharmacy, call 811. There are a bunch of links for children as well. Where do you go to? There's a new clinic called Kids Come First. So if kids have some sort of issues like some light scraping or anything like that, you can quickly go to one of their clinics. It's at Shio. It's at Shio as well, but just not in the emergency. So there are resources. It's just a lot of people don't know about them, and that's the whole point of our conversation with you. We want to make sure that you know where to go at the right time. But in general, it's not a simple question. It's not just too many people are going. They also don't have enough doctors in the emergency. They don't have a lot of money that's funding them. There's issues with the government right now in Ontario with hospitals. There's a lot of issues that make this problem. But I think something simple that we could do is go to the right place when we have those questions and get the answers that we deserve. that's totally. This mic is has been a little tricky, but no, that's totally it's totally understandable. Yeah. So one of the things that we're trying to do is take all these lessons that we're getting from you guys and having this conversation and bringing this up elsewhere as well. So it's not just like it's not that you're just telling us and we don't do anything with it. We will be even the hospitals in itself, a bunch of hospitals. What we're seeing in the community. So I really appreciate your concern, and that's something we've noticed as well. We work in public health. Understand how difficult it is, and it's terrible. People are dying, and people don't get support that they need. But it is a shame that people are being hurt by the system when the system is supposed to be done. And you're right. And we will be taking this information further, and it's just part of our initial preliminary part of just getting that information, making it ready, and then we'll deliver that afterwards as well. And we'll let you know what happens afterwards.
Yeah, it's definitely an unfortunate problem. It's a failure in the healthcare system for a country like Canada to have 12-hour, 14-hour wait times. I personally had to wait 10 hours for my broken foot. It was incredibly stressful, but there are so many nuances, there's so many small things that create this problem that have to be solved. And each step, one small thing gets solved, and it moves just a little bit better. I know that it's not going to be at a level where we feel like this is what we deserve. Canada has a long road to reach that level, and the efforts that we're making, and just to give you one tool that might help, is just like how you said that you called the hospital to see the situation. There are websites around Canada that look at wait times at hospital in real time, and so whenever you want to go to the hospital for emergency, you pull out your phone, you see, okay, what is the wait time? It's all hospitals are going to have a wait time, that's a given, but you can then move and make the best decision to go to a hospital that might not have the longest wait time. And there's more research, there's more effort to build these tools and make them even better, so that it's not the waiting or the doctor problem that we have to solve, but it's also the system that we have to solve as well. So right now, Canada proposed new grants, new programs to build up doctors, but we understand that'll take time. To help us today, to help us right now, is using these small tools that might make it just a little bit easier, and also looking towards community to make sure that our community is healthy, that we see the problems 2-3 years before they happen. So as the population of Canada ages, as our communities grow tighter, we then form this system where we know each other, we know how things are with each other, and that we can care for each other, even though you all have the right and deserve a better healthcare system that we both will be advocating, we both will be working extremely hard to provide for you. So we hear you, and we definitely share the same thoughts and sentiment, and we seriously think that that is problem number one that we have to solve. So thank you so much for bringing that up. Yes. Yes. Yeah. What number was this? 811.
Yeah. So no, 100%. I've honestly dealt with that too. There are I think the problem it's just so annoying. Like everybody's so and there's everywhere. Every time you ask for any resource, you try using it, it doesn't work. And I think that's kind of like the whole thing. We want to present it. Yeah. Exactly. For sure. Yeah. sorry.
Yes.
So, so there's ultimately there's three ways that you can actually get a family doctor. One of the ways is one, applying online. That is done. It's like an online system that just does that for you. Oh, sorry. I don't know why it just keeps. So yeah, sorry, I kept doing that for a while. So the first thing you have to do is apply online. So that's like that's a thing that goes through the Ontario system, and you have to do that. But the second way is to call as many places as possible to ask to see if they have an availability, meaning like if they have a spot open for you. That's the second way. And the third, like I think there's another way in one of the pamphlets as well, and I think it says. And the other way is just doing a general doctor search online as well. So unfortunately, that's the only three ways to get a family doctor, because they have to give you one by putting you on the system. And because of that, it just takes too long. And I think last I heard was, I think 3 million Canadians or 3 million people that live in Canada currently can't even access a family doctor, and I think 7 million or something like that don't have one, including those 2 million. So those are the only three ways to get a family doctor. But the fastest way is probably calling every family doctor, every clinic, and asking them if you have an availability. And unfortunately, we have to keep doing that over and over.
You can also start by asking your community who has a doctor and ask for their doctor. And then reach out to see if that doctor has space to take you on as a patient. You're part of a community that might be able to help, and that's our first point. The next thing is that we have governmental resources and websites that you can go and reach out in other ways. Of course, with the whole system and seeing it from outside perspective, it seems like everything is just not going to help. But it won't change unless you try to reach out or ask questions. So in this lecture or in this presentation, the best way looks to be from community. Yes.
Yes. Yeah. It's really tricky. It's because honestly, I'm not a physician. I'm not a doctor, so I don't know what the difference between a doctor and therapist is. Exactly. Yes. Yeah. Exactly. One of a bunch of people that we know are doctors. They've come from different places. Like during our Masters of Public Health, we worked with 3 different physicians that were studying their masters. And one of the things that they were saying was that when you come to Canada after doing a MBBS or MD or degree, one of the things that Canada as a whole just makes it harder because there's more exams you have to do, and there's more residency that you have to do. And they did this on purpose, because it's in a way, in a sense, it's a little bit of discrimination. And one of the things that we've been talking to people that are in politics, they're pushing for decreased things that they need to do to become a doctor here. So they're called International Medical Graduates, IMG. And they're changing the legislation. They're trying to change the legislation right now, the laws, to make sure that they can actually start practicing a little bit earlier. But they unfortunately still have to study for their exams and do the exams. So the whole, they're trying to change it. It's just so slow that it's not working.
I'd want to mention that this has been the question of the day. You have doctors from other countries come to Canada and then say, oh no, you're not a doctor here. That doesn't make sense. Exactly. So when this problem came to the government, and it was only an effect recently, where we have degrees from Europe that are now considered Canadian doctors. There's a medical school called RCSI that recently changed from an international position to a regular Canadian position. So a little bit of a context for medical school. When you go into medical school and you finish, then you get to the stage where you have to match to residency. Then you have to either become a resident of a specific specialty. The medical schools around Canada look at the list of people and consider, oh, did they do medicine here or did they do medicine in another country? That is where the discrimination becomes difficult. When you come from another country, they'll be like, oh, you're not from Canada. But now recently with the school in Europe, that has now been recognized as, if you graduate from there, the Canadian medical schools will see you as, oh, this is a Canadian school. So this change is coming to an effect where international medical students can come to Canada more easily. And this solution that you brought up is something that Canada has to pick up and run with it. The other issue is that Canada doesn't have many med schools. There's only a handful in this country, so they're not pumping out enough medical practitioners. So they have to lean in to the international community for doctors. So that's a big aspect, and that's a big thing that we want to promote and push forward. So thank you so much for bringing that up.
So a lot of these questions that you're asking are great questions. We're not people that can make that change right now. Like, unfortunately, we're hoping to be those people that make those changes. But it's a great question. We just want to make sure that you understand, because we can't make that change tomorrow, but we will try to make that change eventually. Yeah. Yeah. No, 100%. I totally agree with you. Yes. Question.
Responding on behalf of Dr. Suleiman regarding the healthcare system since the last 40 years.
Yeah.
He's working for around 25,000 patients. His son is a doctor, going to bring him from the overseas, and then he was telling me the reason is why he needed that after he had completed and did all the service he has to come and do the 4-year course again to get qualified for the Canadian doctor.
Yeah.
Because in the back, what it happens, the service of the medical school class, with every patient you come, you make a money, and that add up something, and a Canadian, the doctor plays the game behind the screen. So the purposely, if the back person come directly and get it, he was saying as a joke, they will come and involve in it, they will expedite the services quick and fast, and then it will be a problem. Like I have another person who worked with Healthcare Canada, when he got a job in the beginning days, he went there and all the file of the work was piling up since the last 6 months. He cleared in 1 day. And then the other person said, oh, we have a coffee. You had the chance to watch a news or not. So they say 1 day we go work, half day we watch movie in the news and here and there, take a coffee and stuff. Another, in the from Thursday is the holiday beginning for the week. So half day in the government system is working. So very frankly, like you say that, I was in a belief that some systems are very good. Like just 2 days back, I was in the Service Canada, and I was shocked when they shared the video in the public. I went in, within the 3 minutes, my passport was made, my child passport was made, the SIM card was issued. I was like, this was a Canada. This is how sounded the Canadian. Canada is a great country. But at the same time, when it comes to the healthcare system, is a totally upside down. It's the same like a backpack.
Yeah. No, that's totally a fair complaint. And
Yeah.
yeah. So, unfortunately, that's just, as we kind of mentioned, we totally understand that. And there's so many problems with the healthcare system, but I think just fixing one thing doesn't fix the next. There's more problems that you have to fix. There are people that are not that, they're pretty incompetent and they don't help, but there are people out there that are trying to do good work and are trying to support people that are really good. And like it's everybody's having a bad experience, and it's not helpful at all.
It's definitely that the system, specifically for health, becomes very slow, and that the change for that comes from these community presentations, that when we hear this, we go to them and be like, it's not our opinion, it's 1,000 people we've personally talked to. Then our voice becomes heard. So whenever we come in to try to promote and hear your stories, these stories translate to try to move the needle when it comes to the government.
And one of the things that I think we've also kind of encouraged among a lot of different groups is talking to like the politicians and explaining our situation and what we've gone through personally. They're here to listen to us. They're supposed to be working for us. They have to make legislation for us. And even if they don't want to listen, they have to listen. Yeah. Exactly. And, yeah. And unfortunately, there's people that are like that everywhere, right? But it's you have to keep saying something and keep telling them what you think. And they're here to work for you. They're here to make you they're here to work for us, right? As a community, you have to speak up and you have to say anything. But the first thing that we have to do is have a conversation like this and understand that everybody is dealing with the terrible system that we have right now. And we will also bring this up as well. To a lot of different places, hospitals, politicians as well, we will talk to them. So unfortunately, we are trying, and we will be doing stuff with it. Just letting you know, just to make sure. Yeah. Does anyone have any other additional questions about any of the stuff we talked about? Yes. Sorry. Okay.
Walk-in clinic.
Oh, walk-in clinics. Oh, sorry. I heard. Sorry, my apologies. I heard working. So my apologies. So, Canada has a public healthcare system, right? And a lot of the times, so one of the other reasons why there's long wait times is that they assess based off of need. So let's say someone has a broken leg versus someone that has a terrible illness, like a heart attack, let's say. Hopefully no one is having that right now, but just an example. I just want to make that clear. No, exactly. But so what they do is they essentially just prioritize who has the worst thing and then who has something that we can fix later. So what they do is everybody that is not dealing with a lot of pain, they will move to the very end. So people that have very simple simple stuff, they'll push to the end. The serious stuff they'll do first. But as he mentioned earlier, people that if you can't assess their pain properly, people unfortunately do have medical issues in the emergency, and they unfortunately pass away in the emergency. So one of the things that you can do is go to a local walk-in clinic that's just it's close by. But even that itself, so many people are trying to go there, it gets really busy. So you have to go really early, and you have to unfortunately really early to be in line to hopefully see someone. Exactly. So it is a little bit different because the walk-in clinic. It depends on the type of illness that you have. So can you give an example?
Let's say your ear hurts and that you find that there might be an infection in the ear or that it hurts deeply. You can go to the level of pain or the level of how much it expands or actually goes through. Then there would be an emergency case of that situation. But if it's constant pain that's still there, then there might be a walk-in clinic option for you. So these emergency cases, since they prioritize extreme situations in terms of who they give care to, if you think about it, if it's just not a lot here and you want to go, then you walk into the emergency and they ask you, how much does it hurt, or what kind of pain is it, and then you tell them it's chronic, it's pulsating, it's a 7 out of 10, or it's a 6 out of 10, they'll be like, okay, wait. But if you go to a walk-in clinic, they might see you first. They might see you a bit more earlier than if you went to the emergency. But if you had a situation where it's extreme pain, excruciating, and you need care in that immediate instance, that's where we have emergency situations where if you go to the emergency doctor and you are really, it's showing in everything, they will then prioritize you for care. So when you're thinking about situation, it might not be you personally, but it might be someone that you have to care for. And those decisions might rely on what you know about the system. So that's how walk-in clinics kind of can be put into your head. You can also just walk in clinics when you don't have a doctor on phone or someone that you know. You just walk into a clinic, they'll have a doctor there for you. It's also in the case of vaccinations.
Yeah, and in terms of like even the ear infection thing, you can go to the pharmacist, like go to any pharmacy, and they will answer the question. So it's like, because sometimes the question is, where do I go? And if you go to a pharmacist and you have something like, I remember the other day I was very sick. I think I had the flu. And so I went to the pharmacist and I said, what medication should I take? Do I need any antibiotics or anything? And they said, okay, I think you have the flu. What are your symptoms? They asked me the same questions. They showed me which medication to take. I went home, took the medication, I felt a lot better, right? But those are things that sometimes people go for. But in terms of like even infections, those are stuff that you can ask questions to the pharmacy. But if it gets worse, then you have to go up to the next level, which is walk-in care. Or if it gets even worse than that, the walk-in clinic will tell you to go to the emergency. That's what happened to me too. I broke my foot. I went to the walk-in clinic. They said, "Why are you here? Go to the emergency." So it does happen. And
yeah, as you know, like there's not a long line at Shoppers for the pharmacists. There's not a long line in Rexall for the pharmacists. They're open there to talk about. So if you're not sure about whether or not this is emergency or not, but I need to get it checked, go to a pharmacist, be like, hey, what do you think? They'll guide you either, oh, this looks like an emergency, or this looks like a walk-in, or I'm not sure, this is a walk-in or emergency. So these sort of black holes where you don't know what to do, there are resources out there, there are professionals that can still give you a little guidance.
So that's exactly, and one thing that we're going to be working on going forward today as well is also working with a pharmacist in the University of Ottawa, and she's a professor, and we want to also increase that information to everybody else, so that people are also across Orleans and even Ottawa, they're going to get that information at the pharmacy as well. So yeah, it's just to provide everybody that information. But thank you for the question.
No problem. That's right. You guys, you can have the coffee and the Timbits are all there for you. Please enjoy it as well. Yes.
How do I turn this off?